Hi, my name is Isaac Aguilar, and I will be performing a head and neck exam in this video. And this is my assistant that will be helping me with this. To begin, I would perform hand hygiene, provide privacy for the patient, and explain to him what I'm doing beforehand. So for the head assessment, I would start with checking his appearance, making sure his skin is nice and pink, it's moisturized, there's no lesions, there's no scarring or any um, deformities present. I would go ahead and begin inspecting his hair and his scalp. There is no infestations that are noted. There's no moles that are hidden that could be perhaps uh, abnormal. There's no denting. He has a normal cephalic shape, and it appears to be normal. Um, I would go ahead and face the client and put my hands around his jaw to make sure I can feel his temporal mandibular joint, and I would ask him to, can you clench down, squeeze your teeth, okay? And I feel his muscles. Can you do it again? And I feel his muscles in the temporomandibular joint. And can you open your mouth up and down, up and down? And I don't feel any um, grating or any clicking noises or popping noises. So I'm gonna go ahead and considering that I'm focused on his face and check the cranial nerves. We're gonna check cranial nerves 1 through 12. And to begin with, I'm gonna ask him to close his eyes, close your eyes, and I'm gonna ask him what he is smelling to test cranial nerve number 1, which is olfactory. Can you smell? What do you smell?
Coffee.
Coffee, that's right. All right, he could open his eyes again. And we're going to test cranial nerve number 2. We don't have a Snelling chart, but I'm gonna ask him if he could read what it says in this at about 12 inches distance, 14 inches.
Welcome to Salami.
All right, so he was able to read that, and we're gonna go ahead and inspect his eyes. I'm just gonna pull him a little closer. And so upon inspection, his eyes, can you look at, turn a little bit towards me. All right, and he's still in the camera. His sclera is white. There is no drooping in his eyes. And I'm gonna go ahead and check for his reaction to his pupils. Okay, look at me over here. All right, there was his pupils were reactive to light. We are going to go ahead and check cranial nerve number 3, and I'm gonna ask him. Let's face the camera again, and we're gonna scoot back a bit. All right. So we're gonna ask him to follow my fingers in the 6 cardinal points to see if his eyes are both keeping up with my fingers and are able to keep up. And this way, we will test cranial nerve number 3, 4, and 6. So just follow the pen light, okay? Just with your eyes. Okay, he was able to follow my pen light through the 6 cardinal points. Let's go ahead and test cranial nerve number 5 by asking him to clench his teeth. Clench your teeth one more time, like you did. Okay, squeeze down. And can you open your mouth? All right, he was able to open his mouth against resistance. So we're gonna test cranial nerve number 7. Can you smile for me? All right, can you puff your cheeks like, okay? Can you frown? Can you frown? Go down, like this, like if you were sad. Okay, and he was able to show that his cranial nerve number 7 is functional. I'm gonna cover one side of his ear, and I'm gonna whisper something on this side, 2 words or a 2-syllable word, and he's going to repeat what I whisper in his ear. Okay?
Apple bite.
Okay, and I'm going to do the same on the other side.
Basketball.
Okay, so we just demonstrated that cranial nerve number 8 is functional. So we are now going to test cranial nerves number 9 and 10 by asking him to open his mouth. Say, look up for me. Say ah. Stick your tongue out. Saca tu lengua. And say ah. Okay, and his uvula in the back, whenever he says ah, rose to the top. Can you? And that was testing cranial nerve number 9 and number 10. Can you stick your tongue out and move it side to side? Okay, we just tested cranial nerve number 12 and it's functional, and we're just gonna go ahead and test cranial nerve number 11. Can you shrug your shoulders like that? Okay, he was able to shrug his shoulders against resistance. We are going to go ahead and can you face me all the way and test the lymph nodes, and we're checking to see if there's hardness, if there's any lumps or any inflammation in the lymph nodes. So we're gonna start with the pre-auricular, which is right in front of the ears right here. Move in a circular motion, move down, up and down, and there's no hardness. We're gonna go post-auricular, right behind the ears, and checking for any hard lumps or abnormalities. All right, let's go a little bit this way. So that abnormality. So this is the post-auricular. We're gonna go to jugulo-digastric. Do you feel any pain? No, does it hurt? And there's no hardness, lumps, or anything like that. We're gonna go to submandibular. This was jugulo-digastric. Submandibular. Does it hurt? Let me know if it hurts, okay? Submental. And we're gonna go to superficial cervical. And we're gonna go down the deep cervical chain. Feeling for any of those lumps. Does it hurt? Do you feel any tenderness?
No.
And we're gonna go posterior cervical. Can you stand up a little straight? Posterior and turn a little towards the camera. The posterior cervical and the supraclavicular. I'm sorry, right over the clavicle bone. And there was no. Thank you. There was no hard lumps or any abnormalities, no inflammation of the lymph nodes was present. We are going to inspect his tympanic membrane, his ear canals with an otoscope, which is what I have here right now. And so I'm just going to go ahead and turn it on, check that the light is working. And since he is a kid, we are going to pull the pinna down and back instead of up and back. So I'm going to invert the otoscope to see if I can observe his tympanic membrane. So in his left eye, okay, his tympanic membrane is pearly gray and translucent, and in his left ear, the cone of light was seen at 7 o'clock. We're going to go over to the right ear, and again, I'm going to invert it for safety in case I go too far in. I could stop a little bit ahead of time, so I don't want to stick it more than halfway through. Okay, I am able to see his tympanic membrane, and on his And on his right side, the tympanic membrane is also gray, translucent, pearly color, and the cone of light on his right side was seen at 5 o'clock. So up next we're going to check his eyes, and we're checking for an eye reflex. So we have switched to an ophthalmoscope, and that one just snaps right on just like the other one. I'm going to turn it on and check for the light, which is working. So for his left eye, I'm going to come in using my left eye to observe at a 15-degree angle, and I'm just going to search for that red reflex. So look forward for me, please. Look forward, straight. Oh, yeah, just straight. Now there was a red reflex, and I'm going to go over to his right side and use my right eye to look into his right eye and search for that red reflex. Again, just look forward for me. A little bit more right, this way. Yeah. Okay. The red reflex was also observable on his right eye. To finish up head and neck, we are just going to take a look at his nasal passages, make sure his nose looks within normal limits. Upon looking at his face, I can see his nose is midline. There's no deviation. There's no scarring or lumps on the outside. Can you look up for me? We're going to use a pen light. His nasal passages are patent. There's no obstruction, no polyps, and his you can close your mouth. His septum is midline, and there's no deviation. So with that, we conclude our head and neck examination.
Bye bye.